Toronto is increasingly bearing the brunt of the pandemic. Since May 10th, more than 40% of Ontario's new cases have been in the city. Now we know exactly where. The highest concentration of outbreaks are in the outer edges of the city. One area had 1,500 cases per 100,000 people. On the low end, one neighborhood just had 39. COVID-19's disparities laid bare, which may explain the mixed feelings about releasing the data.
I don't want to stigmatize one certain, 10 streets.
I believe this information, releasing it to the public, will do far more help than it will do harm.
To really see where...
This infectious disease specialist says the city made the right call.
It's just extremely important that we know so we have a much better understanding of where this infection is and where, of course, public health resources should be poured into.
The neighborhoods hit the hardest fall into two very different camps, either communities with more seniors that are majority Canadian-born and higher income, or predominantly immigrant, lower income, and less likely to have a university degree.
COVID-19 is not a great equalizer. It has been a cruel exposer of the fault lines and long-standing poverty and inequality that has been in place.
This public health doctor says quality of housing and employment have long underpinned poor health outcomes, and COVID is no exception.
Poverty is the pre-existing condition. It is the risk factor. If you look at, race and immigration status, those are the risk factors. That is what we're seeing. That is what we've known for a really long time about these disparities.
The City of Toronto says the outbreak map will assist in redoubling efforts to get more people tested. But fixing those disparities that made those neighborhoods more susceptible will have to be a long-term goal. Vic Adopia, CBC News, Toronto.